Today I'm going to talk about MCH Handbook, Ensuring Maternal Child Health Care Amidst the Pandemic. My name is Esifoluwa Amwafo. I work with the Ghana Health Service, and I'll be doing this presentation with these co-authors, 7 of them from the Ghana Health Service and the JICA project. The presentation will focus on MCH record book development process in the country, the progress of national rollout of MCH record book, promotion of essential MCH and nutrition services under COVID-19. I'll give you some historical background for the development of the book. The Ghana MCH RB was developed in 2018 by the Ministry of Health, the Ghana Health Service, and other partners with technical and financial support from JICA. And the aim was to promote quality continuum of care and use it for quality of care integrated maternal and child health and nutrition services, improve communication between health providers, clients, and family members, and empower women and family members. After a long process of development, the book was launched by Her Excellency, the Second Lady of the country, an indication of high-level commitment. The book has gone through a lot of processes and has introduced, I beg your pardon, new features. This includes features for assessment of estimated weight at delivery using the BMI for pregnant women before the pregnancy proceeds beyond 12 weeks. And then there is improved health messaging and illustration to enhance communication to all. And for the first time, we've introduced the measurement of length and height of infants. And there's the nutrition counseling tables for pregnant women and caregivers, and a system for ensuring continuum of care. And some of the essential elements that are being implemented is the nutrition counseling clinic services, respectful care introduced, and making the services patient-centered, and improve communication skills and effective utilization of the book, as well as enhanced monitoring and supervision. So just to show you some of the illustrations that we have introduced to the book, in the top left corner, you can see the instructions that is used in the book, and it shows feeding recommendations that helps for women who cannot read and other family members. Below that, you can also see the table that is used to assist women arrive at estimated date of delivery, and also to plot height and weight measurements. And the book is color-coded and beautifully designed. And on the right side, you can see the nutrition counseling tables that is used for counseling of pregnant women and lactating women on their own health and their children. And the advantage of this is that it allows a systematic engagement of the mother going through an assessment of her situation or that of her child, and analyzing the information and using that to make small doable recommendation for the mother. And that way it is participatory and engaging for both mother and health worker. This shows you the processes that we have gone through to date, starting from the pre-testing and pilot testing, and then the development of the national version that was completed and distributed nationwide, procurement of equipment to facilitate the rollout. And to date, we have trained over 860 facilitators across the country, and the training is so ongoing, and we have reached over 1,800 health workers, and we've done sensitization across the country to ensure that other stakeholders and leaders have a buy-in to ensure sustainability. Monitoring and supervision is key and is integral part of the process. And through that, we have assessed that there is 80% utilization of the book, and there's the development of materials, and this is also integrated in the use by other partners, with the World Bank, UNICEF, and others having supported the training as well. And the development of management guide is ongoing, and a series of workshops have been conducted to that effect. To ensure a standardized training across the country, we have developed a number of documents: operational guideline, user guide, trainer's guide, participants guide, a 4-day training curriculum, checklist for monitoring and supervision, and a flip chart. And you can see copies of that on the right side. And this helps the Ghana Health Service to promote and support others to use the program in a standardized way across the country. And on your screen, you can see pictures from the training across the country, being very participatory, both classroom training and on-site training on the field, where we have opportunity to actually have real life experience in the training session. Now, with the outbreak of COVID-19, there was growing concern about how to ensure effective containment and prevent the spread of the virus, but also concern about the possible low uptake of essential services. And you can see on your left that already, looking at one region, that's the Greater Accra region, we had seen indication of reduction in uptake of services. And in response, we developed tools and training guide on MCH and nutrition services in the context of COVID. And the guideline focused on how to modify service delivery and rearrange and triaging of patients to reduce overcrowding and enhance flow of patients at the clinics. And we have done orientation on infection prevention and control, how to link the preventive services to ongoing COVID testing, enhanced contact tracing and treatment. And there has been a supply of PPE with the support of our partners. And key messaging on prevention is communicated across the country during the contact with the MCHRB services. And these are copies of the documents that we have developed in collaboration with the Ministry of Health, the Ghana Obstetrician Association, Pediatric Society of Ghana, and others. And the guidelines refers to the effective use of MCHRB to promote continuum of care. And the expectation is that it will intensify behavior change communication and use the book with the new information on COVID prevention to maintain healthy pregnancy and child care. With the support of JICA, we have expanded the printing of books to provide more books for dissemination across the country. And we continue the training on risk mitigation and the finalization of training materials, job aids, monitoring and supervision tools, and sometimes using online technical meetings and virtual meetings to avoid coming face-to-face, and procurement of equipment for measurement for selected districts is also ongoing. And you can see a picture of presentations at the bottom of your screen. On the screen, you can see pictures for training sessions where all the necessary protocols and mitigation measurements are adhered to strictly. And we've reduced the sizes of training to make sure that we do not put anybody at risk. Finally, by way of moving forward, we are strengthening the utilization of the maternal and child health record book and the nutrition counseling services integrated in the routine maternal and child health services. And key critical measures under discussion for sustainability of the use of the book includes national coordination mechanisms, expanding printing and logistic management, discussing issues around copyright, and tracking of the distribution of the book and involvement of private facilities. We are strengthening the training on infection control and prevention, linking this to enhance containment measurements across the country and treatment and care of asymptomatic patients. And finally, the Ghana Health Service JICA MCH project continues to roll out and institutionalize it across the country and in all the health system in Ghana. Distinguished ladies and gentlemen, I thank you for your kind attention.
Thank you very much for your contribution, Mr. Foriba.